Here are my 5 unpopular beliefs as a vascular access nurse. No one needs an IV in the AC. Oh, but they need to go to CAT scan to rule out pulmonary embolism or something like that. Nope, because as a vascular access nurse, if I get paged for an inpatient who needs an IV to rule out pulmonary embolism, chances are I'm going to put that 20 gauge in the forearm. The 20 in the AC is just a myth and something that people prefer, but it is not a necessity. Oh, but my hospital policy says that it has to be there. Policy is not best practice. So yes, it might be your policy, and I'm not telling people not to follow their policy, but if we're talking about an actual necessity for the patient, it's not. A 22 gauge IV is absolutely appropriate for an adult. Actually, a 24 gauge IV is absolutely appropriate for an adult. There's this current discourse happening right now in one of my posts where people are debating why an adult patient would have a 22 gauge. It's absolutely appropriate. As a matter of fact, if you talk to oncology nurses, chances are if they don't have access to a port, they're going to put a 24 gauge in their patient to infuse their vesicant medications. Smaller gauge IVs last longer, they don't rub against the intima, they don't cause as much mechanical phlebitis, and they're just overall better for most infusions. The only times we really need larger gauge IVs is if we're talking about rapid infusion for resuscitation. If you have to power bolus medications like, blood transfusions or fluids for resuscitation, yes, we do need a bigger one, but chances are if you don't need that, a smaller gauge is better for the patient. Double lumen midlines are an absolute scam. If I get consulted for a PICC placement and I check the MAR and there's only one medication order, I will place a single lumen PICC line. And lastly, if the IV is leaking from the insertion site, it's no longer good. Please don't leave it in just in case. It's not working. I don't know where people got this idea that we could leave a leaking IV in because it's still in the patient's skin. If the IV is leaking from the insertion site, even if it's just a little bit, the IV is no longer functioning. Take it out.